those that don't know me, my name is Brian Jokis. I'm the Executive Director here at Southwest Ontario Aboriginal Health Access Centre, or often known as SOAHAC. Welcome to the future home of Southwest Ontario Aboriginal Health Access Centre, made possible through the Ministry of Health and Long-Term Care and then Minister of Health, Deb Mack. Thank you for all being here today for the launch of the Ontario-specific Indigenous Cultural Competency Training Program. This is a very exciting time for our organization. Since February 2013, we have worked in partnership with the Provincial Health Services Authority of British Columbia, supported by the Southwest LHIN and the Ontario Ministry of Health and Long-Term Care. With their help, we have developed this training program in response to an overwhelming request for high-quality, Ontario-focused content. Today, we officially launched Indigenous Cultural Competency Training. To tell us more about the program, I am pleased to introduce Gertie May Luis, Associate Director of SOAHAC, who has been instrumental in this initiative.
Thanks, Brian. Welcome to the change. Since the mid-1990s, Ontario government, the federal government, and the Aboriginal stakeholders and communities have been working diligently to change the health disparities of Aboriginal population in this province and in this country. We've made great strides in improving access, in making traditional healing services available, and also in some of the jurisdictional wrangling issues that we have to deal with. One of the things that continue to be a challenge to us is what we've come to term systemic racism. So the Indigenous Cultural Competency Training Program is intended to help us address this. So what does racism in the healthcare system look like? Imagine that you have an accident and you decide you're going to the emergency department. And instead of collecting your health card and your medicine list to ensure effective and quality service when you arrive at the hospital, your family and you are engaged in getting dressed up, putting makeup on, as a strategy to ensure that you are provided with quality care when you arrive, because you become used to facing racism at the emergency department. Imagine also two teens, a brother and a sister, who've come into contact with CAS and the health system, and had, in the span of 9 months, both committed suicide by hanging. And the health directors on the ground called the coroner's office to let them know we're all here to help in an inquiry. And the coroner informs us that there won't be an inquiry, because all the children need to do in that area of the province is to stop drinking, and everything would be all right. Our elder, Jerry Olsman, says that racism is a disease and that education is the cure. He also said he used to go around for years saying, somebody should do something, somebody should do something. And then he finally realized one day, I'm somebody. We're very fortunate here in Ontario, and especially in the Southwest, that we have people like Jerry who take up that responsibility to make the change we need to see. Since 2012, the Southwest LHIN and the Southwest Ontario Aboriginal Health Access Centre, in partnership with the Provincial Health Services Authority in British Columbia, have journeyed to create a new training. When I was working at the Southwest LHIN, we were having a lot of discussion across the province about cultural indicators and embedding cultural indicators in health service provider accountability agreements, because we all understand that this is a systems issue. Then we realized we don't necessarily have a training tool that was easily accessible, spreadable, or even affordable available to us and to health service providers. So at that time, I was working with Kelly Gillis, who would be, don't we have that safety trainer who was working at SOAHAC at the point? It was our single resource for cultural training in Ontario, and this was Guy Hagar, who was in the back. He was our cultural safety trainer, and Kelly Gills kept saying, can't we do something more with that resource? Isn't there more we can do? And Mike says, can't we get something online? Shouldn't we be doing something online that everybody could access? These were all new ideas. And with the leadership of Guy Hagar, Brian Dokies, Doug George at SOAHAC, and then Kelly Gillis and Mike Barrett at the Southwest Lynn, we started to really engage ourselves with discovering new ways of doing our work. So Guy Hagar used to say to me, Gertie May, I think they're doing something incredible in BC. I think they're really making some change there. So when he did research, and we found the Manager Share Award at the time, and began a dialogue, and immediately we began a partnership. They agreed to incubate an online Indigenous Cultural Competency training for Ontario. We are, this was under a year and a half ago that this dialogue started and this partnership started, and we've come a long way. We registered our first learner back in May of this year, and just last week we now are at 500 learners having gone through the program. Over half of those come from the Southwest Lynn area, and we're now gearing up to ramp up in the next 6 months for provincial spread. The success of this particular training is really because it focuses not only on telling Canada and the health system about us, about Aboriginal people, about our communities, about our struggles, about our history. It really takes a focus on racism and taking a closer look at it. So the training is really based in anti-racism education and transformative pedagogy. And we think that this is what's really making the difference, making the change. So one of the things that we are really happy about is that we've been able to do this in this environment where, you know, racism is kind of a dirty word. It's kind of an ugly word. Nobody wants to deal with it. But through this process, we've been able to actually open the dialogue. And it's through this dialogue and this collaboration that I think we're really, for the first time probably in a long time, really making a real difference. So personally, as a First Nations woman, I'm very pleased about the potential of what we've started here. And I can't express enough how happy I am as a First Nation woman that I can feel confident when I wake up in the morning that change is coming. Thank you very much. Now I have the great honor of introducing London North Centre MPP Deb Matthews, who we've been very fortunate to have been with us through this entire journey.
Gertie May, I am absolutely delighted to be here, and delighted to be here with Jeff Lowe of the Southwest Lynn and Michael Barrett, because this is something we were able to do by working together. You know, for me, and I think for many, I can say that although we are enormously proud of our country and our province, our greatest shame is the inequity in health outcomes between Aboriginal people and the rest of us. There is no excuse for that, and there are many reasons behind that. I think we all have an obligation to turn our attention to closing that gap, and that's why today is such an exciting day. You heard Gertie May talk about improvements to access. It's true through places like SOAHAC. There are better access to care for Aboriginal people. But the missing link until now has been that understanding, that they're stating for you sociologists out there. Because I think behind every stigma, behind every racist attitude, there is a profound lack of understanding. And once we start to understand each other better, we can have more respect for each other. And I think respect is foundational to the relationship between the healthcare provider and the patient. So what this project does, it's already brought hundreds of providers into a better understanding of Indigenous culture and some of the reasons behind that gap in the health outcomes, and hundreds more to follow. So I really think today is a day to celebrate a big step forward. And Gertie May, I want to say chi miigwech to you for doing something about it. I also really want to acknowledge, as I say, the Southwest Lynn. To me, this project is another example of the best of Lynn's. They have an opportunity to actually focus on issues that are high priorities in their area and invest money to address those. So Jeff and Michael, thank you. And I'm very much looking forward to hearing about the outcomes from the education that people will receive thanks to your enormous hard work. Miigwech.
Good morning, my name is Jeff Lowe and I am the chair of the Southwest Lynn. And I had one of those aha moments this morning when talking to Gertie May, a former Lynn colleague, Deb Matthews, the former Minister of Health and Long-Term Care, and now in other ministries, and how the system actually can work sometimes. That the interconnectivity among different operating areas and different government areas come together towards a common cause when people are like-minded and put their minds to getting great things done. And I think we're seeing an example of that here today. I'm pleased to advise that the Southwest Lynn and its board is providing some $250,000 of one-time funding for the initial implementation of this training. And over and above that, we look forward to continuing our support to SOAHAC through annual base funding allocations so that this training in the Southwest can continue on for some years to come. All of the Ontario Lyns, for that matter, are looking forward to unique culture-based services and training for providers. That's all across the province of my fellow chairs and Mike's fellow colleagues in the other Lyns. Certainly the Lynn is committed to enabling equitable, culturally sensitive care through programs such as ICC training. The topic, not specifically ICC training, but the topic is a constant one on our agenda at our board meetings for generative discussion and just conversation and understanding and education. And it's one area that we are working at quite diligently. We certainly believe that respectful, trusting relationships between health providers and Indigenous people built on culturally competent care can only create positive patient experiences and environments. It's important. The province of British Columbia, whose ICC training has partnered with SOAHAC to develop the training program here, has started to measure some significant improvements in patient care for Indigenous people. As a result of this training, Southwest Lynn hopes to enable similar success through the local health system. So again, on behalf of the board of directors and the staff and administration of the Southwest Lynn, I want to thank SOAHAC, thank all of you very much for your leadership in helping design a health system that is equitable and safe for all residents who call the Southwest Lynn home. And we wish you every continued success.